Welcome. My name is Jasmine Kamboj, and I'm a medical oncologist and hematologist in the state of Minnesota and your host for the day. Empowering Oncologists is a podcast brought to you by OncoDaily, where we will focus on day-to-day concerns of an oncologist's being and workflow, with a vision to find sustainable solutions. We hope to share our stories of wins, losses, resilience, and inspire and empower our community because we fly higher and longer when we fly together. Before we dive in, a disclaimer. The views shared on the podcast are an individual's and in no way are views from any organization, institution, or guidelines. For our session today, we have Dr. Shushan Hovsepyan, a pediatric oncologist and Senior Vice President of OncoDaily, where she also serves as Editor-in-Chief of the OncoDaily Medical Journal. She is the co-chair of SIOP, which is International Society of Pediatric Oncology, Global Health Network Research and Innovation Working Group. In her free time, Dr. Shushan loves to travel, explore new cultures, and swim. Dr. Hovsepyan, welcome and thank you for being here with us.
Thank you so much, Dr. Kamboj. It's an honor for me, and I'm super excited to our conversation.
Wonderful. Thank you. Dr. Shushan, tell us about your journey. Like, how did you get to a point where you wear so many hats and you're doing it so graciously and successfully?
Yeah, so thank you for the nice introduction as well. And my journey actually began in pediatric oncology quite unexpectedly. And I remember that when I was a fourth-year medical student at Yerevan State Medical University, I attended an oncology course, and our lecturer was Professor Georg Tamamian. And when he was asking everyone what profession we are going to choose in the oncology field, and when my turn came, he asked, "Do you want to become a pediatric oncologist?" And I said, "No, definitely not. If I ever go into oncology, maybe that would be adults, but definitely not pediatrics." And yet, by the end of the course, I was fully convinced that pediatric oncology was my journey. And when I entered into the fellowship program under his supervision and mentorship, having him as an exceptional example, I was really motivated to go forward and learn as much as I can in oncology. And I applied to the European School of Oncology Clinical Fellowship Program. And that was the COVID pandemic time. We had a war in our country. So locally and globally, the situation was not as good as we wish for. And I got accepted, and I went to Milan, to the National Cancer Institute in Milan, and I entered into a completely different world with my mentors, Professor Andrea Ferrari and Michela Casanova. They taught me everything from A to Z about sarcomas, about adolescents and young adults with cancer, and I fell in love in that field. And I was seeing sarcoma patients that I've never even read about that in my books. And then I couldn't also forget to mention Professor Maura Massimino, who extended my fellowship, as the official one was 6 months, and then I did 1 year. So from Milan, everything started, and then I went to had a clinical training in Vienna at St. Anna Children's Hospital, then a short research fellowship at EORTC. And in the meantime, I also completed the Harvard Medical School's effective writing for healthcare program, where we learned how to write manuscripts, submit grants, and so on. So yeah, and then I came back to my home country, and all these experiences actually have shaped me into the pediatric oncologist that I am today, both in the clinical knowledge and also in the approach to patient care.
Wonderful. That sounds like a fascinating and a wonderful journey. I have 2 questions there. One, how many languages do you know?
Well,
To have bounced around through so many countries.
So I speak Armenian, Russian, Italian, English. Yeah, and that's it.
Wonderful. That's amazing. You're a Duolingo in yourself. And my second question, tell us a little more about your Harvard training. So you had a training just to write manuscripts?
So the training was a 1-year intense program where we were working on different projects, and at the end we had to have our capstone project written
Mm-hmm.
as a written manuscript. But we
Mm-hmm.
were not only writing in the medical science field, but also as an open public writing and also grant writing. And it
Mm-hmm.
was quite strong and intense program for 1 year, where
Uh-huh.
we were working in different team groups. We were having a lot of assignments, and it really helped me to understand how the manuscript or how the writing process is ongoing. And it helped me to choose the words that right now I'm choosing by thinking,
Mhm.
and not just only because it's intentional and everyone is using that word. So it was a very good experience. And if someone is interested, I would highly recommend that course because it changes completely your view how you write.
Right. And you can, if somebody is interested, how do we pursue this Harvard course? You just go onto Harvard website, or are you selected, or is there like an exam or test you have to take?
So, of course, there is an application form with a couple of things that I cannot recall right now. But yeah,
Sure.
you apply and then you wait for the results.
Brilliant. That sounds fascinating. Thank you, Shushan. You have so many roles with OncoDaily. And OncoDaily, correct me if I'm wrong, it started 2 years ago or 3 years ago?
2 years ago.
2 years ago, and it has just exploded in its outreach and the number of projects it's doing. It's doing wonderful work. Tell us about OncoDaily and your engagement with it. How did all of this get started?
Yeah, so OncoDaily, in one word, I can say that it's a family. And I was first looking from this side, watching OncoDaily group day by day, and the energy was really infectious. And it started with just one employee and quickly began to expand, as you mentioned. And soon we are launching a lot of new projects, programs, initiatives, and it grew really fast. And then OncoDaily Medical Journal project came, and I stepped in as an editor-in-chief. And at the very beginning, it was quite difficult to manage the journal because you know that a lot of journals are out there, and it's very difficult to convince people that you are giving the evidence that is required for the oncology field. And then, but now when I'm seeing a lot of activity in the journal, a lot of manuscripts are getting submitted, and we have a lot of reviewers in our and editorial team is quite big. The chair of the board is Dr. Mattia Pro, who is really well known in the oncology community. So yeah, it's growing, and OncoDaily is expanding. It's flying. So we are growing day by day. Now we have more than 40 people working in OncoDaily and a lot of volunteers from all over the world. So, and along the way, I also took on the role of senior VP at OncoDaily. But for me, the most important thing is to be the part of something that brings people together in oncology.
Aw.
And also, as Princess Dina says, Her Royal Highness Princess Dina says, OncoDaily is a place where everyone has a space. So starting from patients and ending with industry representatives and oncologists. So usually it is very motivating to work in OncoDaily and to be the part of OncoDaily because a lot of people believe in us and a lot of people trust in it. So yeah, it's quite a nice journey.
Dr. Hovsepyan, you have been super passionate about your advocacy for limited access to high-cost therapies in, Armenia and other countries who may not be as equipped in terms of funding, etc., like the U.S. or some of the European countries are. Tell us a little bit about it, and how do you go around that advocacy?
Yeah, so it's a very challenging topic, and we know that every year over 400,000 children are around the world getting diagnosed with cancer, and that's about one child every minute. But what matters most that the 80% of children with cancer are coming from low middle income countries. And the survival rates are less than 30%, even it's under 10%. And the reason is not just the lack of knowledge. It's not because childhood cancer are biologically different across borders now. No, the reason is that a child's chance of survival depends largely on the policies in place where they are born. And in just a few months, it's very important to have national policies. It's very important to have the network and collaboration within big organizations and small countries so that we can achieve a lot of great things in this field as Act for Children. For example, there are a lot of initiatives. I would like to mention Act for Children because during that initiative, they delivered over 2.8 million worth of high-quality essential pediatric oncology medications to childhood cancer centers in countries including like Guatemala, El Salvador, and Armenia was one of them as well. So this kind of initiatives help to solve the access problem that we all face in low middle-income countries. Of course, the list is very long, and we can speak about this issue for a long time, but for me it's essential that we need to stop speaking and we need to start acting.
Right. So what is this initiative called?
Act for Children by Serbia and a lot of other organizations.
Got it. And so would you share with us like one big challenge or one big win that you have had through your journey here? Like, was there any time when, you worked on a particular thing for a couple of years and you're like, it's not going anywhere, versus a win? You're like, yes, we made this change. So sounds like Act for Children seems to be a successful initiative you guys had.
Yeah, so that in Armenia, we centralized the care a couple of years ago. And before, when I was entering into my fellowship program here, we were never had the opportunity to have the medications, the innovative treatments that we right now have access to or are available. And it was kind of a dream, but with the help of charity foundations, with the help of our huge and exceptional team that is working on 24/7, we now achieved that. And also when we were starting and our senior oncologists that were starting clinical trials were not accessible at that point, and we did not have the infrastructure. But right now, I can mention that we are our chief of pediatric oncology unit, Dr. Papian, is the PI of the trial that is going to run in 27 countries in Eastern and Mediterranean region, and that is the first time that that kind of trial is going to happen. It's on osteosarcoma patients. So it's something that we dreamed of, and it's now becoming a reality.
Beautiful. I love that. It's fascinating numbers that 400,000 children are diagnosed all over the world with cancer. That's painful to hear.
Yeah.
All right, Shushan. So you mentioned a bit about the clinical trials. How is the clinical trial infrastructure in general in Armenia?
So I can speak of clinical trial infrastructure from the oncology standpoint and from the mainly from the pediatric oncology standpoint. And for us, when in 2022, the Immuno-Oncology Research Institute was founded, and it became the hub for clinical trial activity in our center. And as the pediatric oncology has only one center and everything is centralized, so the clinical trials were run within that institution and with our hospital. I can say that apart from the local network, global initiatives help a lot, and we were the first country that joined the Centralized Global Alliance, which gave us the network, which gave us the opportunities, and also the Eastern Mediterranean region, the International Society of Pediatric Oncology. So having all that collaboration and brainstorming with experts papers, what idea we should bring into the clinic, what idea which we should work on. We started with launching a registry on CNS trials, CNS cancer. We started with a trial on antiemetic medications, again in pediatric setting. So it's growing. As I said, we did not have that opportunity, and now we started in our center, in our institution, and I'm sure that if we speak together in 5 years, we will have more trials to share, and we will meet in conferences and share our results with you. And that's something that is very rewarding, because when you are working and you are dreaming with a huge team that invests a lot of their free time into the development of something that for big organizations maybe it's not so interesting and not so investable. That's very rewarding when you see that the team achieves that results.
I almost feel like there is so much we in the States can learn from you, because ASCO works very hard in creating, better access to some of our remote areas in terms of clinical trials, research. And just like you said, geography should not determine the outcomes of our patients, whether adult or pediatric. And unfortunately, the United States is so huge that we have a lot of rural population and remote population as well. And probably we have the same issues here that you are experiencing in Armenia. It's just that because not everybody gets treated at Mayo Clinic or, in the hotspots cancer centers. There are so many of 10% of, I think almost 20% of the U.S. population lives in remote areas. So it's same issues as you mentioned.
Yeah.
Thank you for sharing, Shushan. You mentioned about research and infrastructure. How hard has it been to, generate funds for infrastructure creation or clinical trial access, etc.? How's funding in Armenia?
Yeah, so for the pediatric oncology setting, we have the City of Smile Charitable Foundation, and with some governmental support, but mainly the foundation is covering all the costs for pediatric patients. So we had the mission that no child should die because of the funding and because of the drug money issues, and therefore the foundation launched, and it plays a crucial role in bridging treatment gaps by covering costs of chemotherapy, diagnostics, psychological services, essential logistic support as well. And with the help of the foundation, we also launched the palliative care unit in Armenia, which was again a dream before the centralization. So I would mention that mostly the charitable foundation is the funding source for pediatric cancer research and also care.
That's great to know. Shushan, coming to some of your personal achievements, I know there are so many, but I'd like to point out one recent one. You were recently awarded the Global Women in Healthcare Rising Star Award. Tell us about that, and tell us the beautiful thing that you posted on social media as to how it all worked out well for you.
Yeah, so thank you for bringing that up. Actually, the award was presented by EMMS International in partnership with Royal College of Physicians in Edinburgh, and it recognized early career women in healthcare who showed some potential and dedication in the field. And for me, it was an incredible validation, but even more than that, it was really symbolic. And we were standing in that gorgeous hall in the Royal College of Physicians in Edinburgh, and was honestly overwhelming in the best way. It was such an emotional moment for me. And one thing that really stayed with me was looking around the room and seeing the portraits on the walls. And there were renowned physicians in different fields, not only in the oncology, and all were men. And there I was receiving the Global Women in Healthcare Rising Star Award in that same space. And what made the moment even more powerful. It reminded me how important visibility is and how meaningful it is to be part of a chain that's making important room for more women as well, especially from underrepresented parts of the world. So it was really emotional.
Beautiful. Thank you so much for sharing. And I respectfully disagree with you because I don't think they give the word to someone who has some potential. I think you have a lot of potential. So,
Thank you.
all right, Shushan. One advice you would give to yourself of 10 years ago.
Well, that's a difficult question. If I could go back and give advice to myself, I would say that don't be afraid to take risks. The safest path isn't always the most meaningful one, I think, and you should always go out from your comfort zone, and in that case you will reach achievements that are not accessible when you are in your comfort zone. So I would tell myself to be bold, to test my instincts, and to take the leap even when the outcome is uncertain. And every risk I've taken, especially the ones that I scared me, ended up shaping the person and professional that I've become. So, yeah, I would say don't afraid to take risks.
Wonderful. That's fascinating. Thank you. Okay, a bit of a rapid fire about you, Shushan. Your favorite book?
There are a lot, but I would mention Never Eat Alone. It's a fantastic book, especially for everyone navigating professional or personal growth.
So is it about Never Eat Alone is about like professional camaraderie, or is it about personal, like family camaraderie?
No, I think it's more of a professional.
Okay. All right. So like by eating together, we develop stronger relationships.
Yeah, it says that, yeah, if you are eating alone in a room where a lot of people are sitting, you are losing the opportunity to work together, and you are losing the opportunity to network and create something that has a value.
Oh, that's wonderful. Thank you. Your favorite leader, Shushan?
I would mention Nelson Mandela for his resilience, justice, and health equity. And I really like the quote that he says, education is the most powerful weapon which you can use to change the world.
Your favorite study, your favorite cancer study?
So as I'm more into sarcoma patients and care, I would mention the maybe larotrectinib trial for intrac fusion positive solid tumors, and it really changed the treatment for soft tissue sarcomas with patients in infantile fibrosarcoma. So that it has a completely dramatic responses. So I would mention that study.
Beautiful, thank you. Your favorite restaurant or your favorite dish in Armenia?
There are a lot of restaurants and a lot of great places. Each place has its own charm, and the food culture here is really rich and diverse. So rather than naming one, I would invite you to Armenia and we can explore together.
I would love to do that at some point. And thank you for the chocolates you got me. They're wonderful. They were gone in no time. Thank you. Other than Armenia, your favorite country to visit?
It's Italy and Milan specifically because it became my second home.
Oh, that's sweet. Thank you. Shushan, a fun fact about you. Please share with our audience and listeners about your swimming endeavors.
Yeah, so I still remember as a child standing by the construction site of the pool and counting the bricks one by one, just waiting for the day it could be finished so I could finally start my swimming classes. And then I was 12 years old and I became the national swimming champion of Armenia, not once, but 3 times.
Wow.
And years later, the funny fact here is that the years later, when I mentioned this to my mentor, Andrea Ferrari in Italy, I said that I was the national champion, and I could see the question forming in his eyes. And quickly added that no, I wasn't the alone on that race, and that was always making me smile.
That's really funny. Thank you. Dr. Hovsepyan, last question for you. If you were to relive your life, would you become an oncologist?
Absolutely, yes. Oncology is not just a profession for me, it's a calling. And few fields combine, like science, humanity, resilience, the way oncology does. And every patient's journey is a story of courage. And science is endlessly evolving. At that constant innovation keeps me challenged and inspired. But more than the science is the human connection that makes me sure of this choice. And oncology teaches you humility, patience, and the value of every moment. And if I had the chance to live my life again, I would still choose oncology, not because it's easy, but because it matters.
Wonderful. Thank you. Very, very well said. Thank you, Dr. Hovsepyan. So the three key takeaways for the oncology community from our conversation today. Number one, folks, don't be afraid to take risks. Going out of your comfort zone is a sign of growth and evolution of your career. And so if we want to go further and advance our careers, I think going beyond our comfort zone and taking risks is something we all should be doing if we aren't. Number two, I think Dr. Hovsepyan said it so beautifully. Geography should not define outcomes of our patients, and we all need to partner with each other, whichever country we come from, to enhance global equity and access to our patients in terms of research, clinical trials, and available treatments strategies. And number three, I liked how she quoted Nelson Mandela, that education is the most powerful tool to change the world. And I feel like we all are privileged that we are in positions where we can partner with each other to change the world. So please don't give up on that opportunity to make your impact big or small. Every impact counts. So thank you to our viewers and listeners. This is Jasmine Kamboj and Shushan Hovsepyan from Armenia, signing off on behalf of OncoDaily from our conversation on Empowering Oncologists. And now you can log on to YouTube and explore the Empowering Oncologist playlist as well. Thank you so much, folks. Thank you.
Cool.
Thanks, Dr. Hovsepyan.
Thanks a lot.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.